Closer. You can do it. Okay, let me show you. This is a hand that had a surgery, and you can see, let me see if I can show you here, the incision. So what's happened is the incision's pretty closed, and the stitches are out and everything. It's just she's got dry, crusty skin. Okay? Dry, crusty skin. So we need to clean it up. Like, listen, we need to clean it up. I'm not gonna lie. When we can get under there, it's hard. And if I push on it, it pokes you. And then she's gonna be like, oh, that hurts me. So, you know, not only are the videos informative, okay, but it's like a little comedy show too, okay? So if you take a look, I mean, everything's pretty healed, but what we need to do is we need to debride all this stuff off. Like you see here, all this, like it's okay to take some of that stuff off. And that's what I'm going to show you next. But I'm going to butter her up, right? So I'm going to butter her up with some heat. And actually, I'm going to put a little bit of cream on it as well, because I need the cream to soften up the skin so that it's easier to remove. It's just that scars, if we know anything about scars, scars are dry. And we need to keep them really moisturized so that we can move them better. So right now, you've got like layers upon layers on top of that scar, and we need to get it off. Again, we ready. She ready. Hashtag she ready. Okay, so let's stop playing around. Let's get to business, all right? I put a little bit of cream on it, and listen, I try sometimes to use my fingers to lift it, but she was a little sensitive. So I opened up a suture removal kit, and I'm using the sutures just to pull the skin off, right? And what I'm gonna do is I'm gonna pull the skin off. And I was already able to remove some debris, some scabs. So right there was one little piece I was able to take off before we got started on the video, because I forgot. So it's already healed, and we know it's already healed. We just need to remove some of this dead skin so that it won't feel so hard and she can feel more comfortable to move it. So right now we have to be a little bit uncomfortable to get more comfortable. Now if you start pulling, you feel like it's stuck and they're painful. One of the things, did you catch that? Did you catch that? So, you know, my hand's on top and she pushed with her thumb. So sometimes I'll loop around like this so that she doesn't push me away. Or I'll just approach it from the other side. I'm just doing that so that you can see. So I'll just nip the skin a little bit so I can pull. So there we go. Now once that's off, like look, if I touch that, does that feel a little bit better? Now that you don't have all that dead skin? She's nodding yes. She can't speak. So, gonna move that thumb out of the way. There you go. Just a little bit at a time. And then I'm gonna massage and just make sure that she's okay and that she's comfortable. Ah. Ooh. Wait, don't go anywhere. It's right on the crease.
Squeeze me? No, you
No.
squeeze me. You don't want. Oh.
Let me take this one little piece off. There, you see? Look at that. Does that feel better? Now it doesn't feel like pinching anymore. And I could really massage there. All right, so let me just trim this part off.
Buenos días.
Buenos días. ¿Cómo estás? All right. Boom. Does that feel better? Oh, so good, right? All right, and so I can
Lift the middle one first.
She's like, I feel so wonderful. I can bend everything, Wong. That's how I feel about you. All right. So a lot of times if you can just like rub it and feel like, oh, okay, I don't feel anything bumpy, I don't feel anything hard, then it'll be much easier to move because it's right over that crease. So every time she would try to bend, imagine that all those prickly things just like digging into her skin. So now we've removed it and she's gonna feel much better. So I'm gonna do the same thing for her palm.